Okay, so can you drive with dementia? So a few months ago, I was in my car just driving down the freeway, and I noticed this car in front of me was just kind of swerving back and forth. As we got a little closer to the car, like I was a little bit concerned. I looked at the person in the car, and they were just like, it looked like they were falling asleep, like or they were like on drugs or something because they were obviously not paying attention to the road at all. This was an older driver too, and I was really concerned about their safety, about other people on the road. And so I called 911. 911 just kind of said, "Don't try to pass them" or anything like that. I was already in front of the person though, and so we reported it to the police, and the police were able to follow up. I didn't get to see what happened at the end of that. I was kind of curious to know what was going to happen. Now, right now, there are more people on the road than any other time in the world, right? We have more cars today, there are more people driving, and we have this huge adult population right now where there's just more people on the road in the United States than ever before. And so right now, it's like there's this huge need for driver rehab specialists. There's this huge need for the DMVs to actually do more assessments with people that are at an older age. There are so many people, I actually talked about this in another video, that there's so many people that are on the road that should be tested for dementia and they're not being tested. There are so many people on the road that have dementia. They've been diagnosed with dementia and the doctor doesn't take away their license or anything. Like there's people that go in the hospital, they have cognitive evaluations. There's neurologists that are seeing these patients. They are telling the patient they have dementia or some other cognitive deficit, and it doesn't get reported to the DMV. They don't get their license taken away. None of that happens. And so that's why it's so important that people get assessed like right when they start to get mild cognitive deficits and they get reported to the DMV. And I'm going to talk to you about how to do that in this video, how they can get testing, and what other steps they can take. So first of all, let's just kind of talk about testing. So if you have a form of dementia or Alzheimer's or cognitive impairment, maybe they have a TBI or they just had a recent stroke, any kind of cognitive deficit, they need to be tested, okay? And the easiest way to do this is to just do a quick MoCA assessment by an occupational therapist. I'll put a link in the description below where you can check that out, where I do online cognitive assessments. But they need to be tested by an occupational therapist or a speech therapist or a driver rehab specialist. And then what you can do, anyone can actually do this at any time. And I usually have people get tested for cognitive deficits first. Once they get tested, and if they have some sort of impairment, they can just get reported to the DMV like right away. And that pretty much fixes the problem for most of these people that are dealing with cognitive deficits. You may think that they need to see like a driver rehab specialist, and I think that can be important if you don't want to go to the DMV route, because a lot of times the DMV will just say like, sorry, we're not going to give you a license, we're just going to kick you out. Like that might be great for some people that want to kind of skip that. But for most people, you really should just do a cognitive assessment. And then if they don't do well, I would just say like they need to be reported to the DMV. But there are a ton of people that can still drive with dementia, and that's going to be more like a mild form of dementia. But if you have like moderate to severe dementia, you shouldn't be driving at all. And that's why it's so important just to get tested to see if they have some sort of mild or moderate or severe form of dementia. Because the main problem is if they have issues with problem solving. That's like one of the number one issues that's going to limit their ability to drive and stay attentive, to be able to concentrate while they're driving on the road. If they have just difficulty problem solving, that can be difficult for anyone that is merging onto the freeway, and anyone that's like driving past a yield sign, someone that goes to a four-way stop. Like there's so many instances where problem solving is really important for anyone who's on the road. So problem solving is huge. Attention is huge, which kind of goes into concentration. You need to be able to concentrate, to be able to be attentive to other drivers on the road. And a lot of times older adults, we kind of lose those skills, just become more soft. They're not as sharp. But for people with dementia, they become way worse than they were before. And so that's why these specific people need to be tested. And then another thing is just vision. Like your vision gets worse as you get older. People need to have visual assessments. The MoCA kind of tests this, but it doesn't do a real thorough evaluation like you would get from like a driver rehab specialist. I think most people just need a good cognitive test. And then if they do like really poorly, there's two options. They see a driver rehab specialist or they go to the DMV and get tested. So what is it like when you report someone to the DMV? So most states actually have a form on their website. If you go to the DMV, you look up dementia, you look up forms for like reevaluation, there's usually a form that most people can fill out that you just put their name, their address. You don't really have to have that much information. It's mainly their age, their name, their address. If you have all of that, you can pretty much report them. And then once you report them to the DMV, and anyone can do this, right? Most people, we're always thinking that like it has to be a doctor that reports someone to the DMV. Anybody can do this. Like if you're a caregiver for a patient, if you're a family member and you notice that there's some significant cognitive decline, yes, you should report them to the DMV. Anyone can do this. It's really easy. You fill out this form and then they will get informed from the DMV. I don't know if it's going to be a phone call or a letter or something. They will actually have to go to a DMV where they do some additional testing. It's not going to be like your standard testing. This is probably going to be a behind the wheel assessment. It's going to be probably some cognitive testing just to see if this person is safe to drive. But if the person that is cognitively impaired, if they absolutely want to continue driving, I would say go the driver rehab specialist route because they want to get you on the road. Whereas if you go to the DMV, they're trying to get people like off the road because they're not going to take all that extra time to do a thorough assessment. But a driver rehab specialist will take a lot of time and actually create goals to make sure that you can drive safely and independently if you're safe to do so. So the number one thing to do if someone has dementia is to get tested, like I talked about in the description below with the MoCA test. The number two thing would be to, if they can't drive safely, you report them to the DMV or you see a driver rehab specialist. Okay, let's talk a little bit about the importance of the Montreal Cognitive Assessment. This is the MoCA test I'm talking about earlier. The Montreal Cognitive Assessment, it's going to check your ability to problem solve. It's going to check your vision a little bit. It will check your memory, if you can recall short-term things, if you can stay attentive to tasks, abstraction. Can you think creatively? Can you think outside the box a little bit? And it also tests for language to see if there's any language difficulties. Now, recently, I actually went to someone's house. They requested a driver evaluation assessment just for cognition, and I did a quick MoCA test and I found out this person, they were not safe to drive at all. But this person had been someone who'd been driving on the road all their lives. They were actually a truck driver. They wanted to go back to their home, like probably this 12 to 15 hour drive, and get all their belongings and bring it back to California. And after doing a quick MoCA assessment, like this person had significant impairments, and I was able to quickly say, you're not safe to drive, you shouldn't be on the road. And we could have done more testing. We could have done a behind the wheel assessment, but I just found that it wasn't really needed. So I did a quick MoCA test with them, and then afterwards I reported them to the DMV so the DMV could take the necessary steps if this person decided that they were going to get on the road. And that way I didn't feel like it was really my responsibility as a driver rehab specialist. I'm putting it back on the DMV so the DMV could kind of take care of this. And I think this is kind of what you should do. Like if you work in a hospital setting, or if you are a healthcare provider, maybe you work in rehab, and you notice that somebody has cognitive decline and maybe they live alone and they're still driving, like you most definitely should just fill out a form for the DMV that pretty much like says that you are concerned about this person's well-being and ability to drive safely. And just filing that report with the DMV kind of resolves the problem for the most part, because this is a huge problem and a lot of people are just doing nothing about it. And if we can just at least report to the DMV, that's going to solve the problem for the most part. Now, if a driver rehab specialist is going to be the best person to deal with these people, but there's not enough of them like around in our cities, in our communities. Like there's not enough driver rehab specialists out there. So we really need to just start reporting more and more people to the DMV once they show some significant cognitive decline. Now, let's say you tested somebody and they don't have mild dementia. It's more of like this moderate to severe dementia, and they really shouldn't be driving on the road at all. What do you tell this person? A lot of times I talk to the person first about public transportation, having a friend, having someone from church take them to the places that they need to get to, maybe just like once a week, right? Or maybe once every 2 weeks so they can be able to do their grocery shopping or do whatever errands that they need to do. I talked to this person about like shopping online. That's not going to work with everybody because a lot of people with dementia aren't going to be able to navigate online. But I just start talking to these people about resources that they have in their community that will help them to be able to get to where they need to be. If that's to the grocery store, what kind of transportation is available already in their community? Can they take an Uber? Can they take a bus? Is there a friend that can take them? If they have a caregiver or a family member that can just quickly take them to the grocery store? Now, it may seem like a lot of work to kind of get someone to learn how to use the bus system or other things like that, but it's helpful for these people to be able to kind of learn that new skill. This is actually good for cognitive processing, to kind of do something new out of the ordinary. If they have the mental capacity to be able to do that, I think that's kind of a good way to go, or just find some sort of caregiver that can help them. And then the next step is just to kind of talk to the person about driver retirement. We all need to eventually retire from driving. We're not safe to be able to drive the rest of our lives, and setting a date, even if maybe this person has some sort of mild dementia, you might just talk to this person about setting a date to retire from driving, give up the keys, and that could be like a year from now, it could be 2 years from now, because eventually we all need to just retire from driving, because it's not safe for all of us to be on the road for the rest of our lives. So to answer the question, can you drive with dementia? Yes, you can still drive with dementia. You can drive with a mild cognitive impairment, but once that cognitive impairment becomes moderate to severe, that's when keys need to be taken away and you need to stop driving. Because at that point, you're more of a risk to yourself and other people on the road, and these people really shouldn't be driving. So I hope that kind of clears up things a little bit for you. If you have any thoughts on this, please leave them in the comments below. And if you like videos like this, please subscribe and like, and I'll see you in the next one. And I hope you have a great day. Thanks.